Hello everyone. This will be a mentorship session for those who are planning to take general medicine for your post graduation. So, I know that sometimes college selection can be a difficult task, and this session is just to mentor you on choosing the right college for MD/DNB medicine. So, what I've decided is I'll be giving you a 10-point checklist that you will have to consider before choosing a college for MD/DNB medicine. And these checklist points I have curated based on my experience of teaching students for uh, NEET PG, NEET SS, so all the entrance examinations, and I've had students, postgraduate students, super specialist students. So based on that experience, I'm just guiding you here. Okay, so let us go through the 10-point checklist. Okay, so again, let me tell you, this is just a guidance session. Well, the college that you are selecting should be based on your personal preference as well, and take this session to be a guidance session, right? So we'll start. So checklist number one that you will have to consider while you select a college for your general medicine residency is the average number of outpatient cases. As you can see that in the slide that I've listed, the highlights substantiating each checklist point. So when you have a high patient inflow, this enhances your practical experience. So you will have to have a decent caseload of patients that come to your OP. And when you have obviously more numbers, you're also likely to have more variety. So when you have more variety in cases, this will definitely improve your clinical skills and confidence as well. Because once you are done with your residency and you are starting to practice, the experience that you gain during your residency period definitely will help you. And the next point you have to consider is that a good OP load will ensure that you engage with more number of patients, and this will enhance your communication skills as well, which is also a serious point that has to be taken into consideration. So this is checklist point number one. Coming to checklist point number two is the average number of inpatient cases. So sufficient IP admissions will again enhance your practical learning experience. And this is essential for mastering the diagnosis and treatment approaches. Now we know that medicine, when you learn it, it's not like you read Harrison multiple times and master medicine. For challenging scenarios, you will have to develop a diagnostic approach. See, patients can come with multiple complaints. You can have a patient presenting with paraplegia, a patient presenting with a central chest pain, a patient presenting with decreased urine output. So, for each of these complaints, you will have to develop your diagnostic approach. So, good number of IP patients will ensure that you get more opportunities for mastering the diagnosis as well as for your treatment approaches as well. Now, a good number of IP patients also will ensure that as a resident, you are ready, you are prepared for real world medical challenges. So, why do I say this? See, what patient gets admitted? Somebody with a serious illness, right? Now, if you want to practice successfully, you should have that training during your residency. And this sort of training will prepare you for the actual world that you're going to face on your own as a consultant post your residency. Okay, that is what I want to tell you. So to know the average number of OP cases, average number of IP cases, you will have to get in connect with the residents of that particular college, particular department to get a fair idea, right? Okay. Now, checklist point number three, a well established ICU setup This again is very important. Now, a good ICU will ensure that as a resident, you get an opportunity for hands on training with critically ill patients. And this sort of exposure is also important because I've seen that in certain colleges, you have got a medicine department with fair enough number of OP and IP cases, but the ICU setup is not that good, which means your training of managing critically ill patients may not be good in that particular setup. So when you have an access to the modern ICU equipment, this will again enhance your skills as a resident. So that again is important part of your residency training. And see, in your ICU, you're likely to have, simulations, right? Actual simulations, I should say. So you're likely to have maybe a patient going into respiratory failure, a patient landing up in a cardiac arrest, a difficult diagnostic challenge, maybe a patient having status epilepticus, not responding to your first line and second line management. So only when you expose yourself to multiple such challenging case scenarios, because obviously ICU means patient is critically ill, so you have got to expose yourself to such scenarios that post residency you will gain enough confidence to deal with such patients, right? Coming to checklist point number 4. Okay, so it is number of residents. Now this again is important. See, I always believe that you are a part of a team rather than you are just an individual while you pursue your residency. So when you have more number of residents in the department, this ensures that you've got good collaboration. And this collaboration is key to effective team dynamics. You learn together, you evolve together, you become better physicians together. But what happens on the contrary when there are fewer number of residents? A fewer number of residents means you will have more workload and you will have more work pressure also. And that might actually make your residency a bit tough. Okay. However, if you have a manageable workload, I told you this balance is important. Yes, you need to have good number of IP and OP cases, but you also need to have adequate residents to handle the load, because only if you have got a manageable workload, this will promote better skill development. Because see, if even if your hospital has a variety of cases, only if you get an opportunity to improve upon your existing knowledge will you become a better physician. So just seeing n number of patients alone will not make you a good physician. You will have to be given opportunities to learn and improve as well, right? Okay. Coming to checklist point number 5, this will be on the number of faculty members. Now, when you have got more mentors, this will definitely enhance your learning and support system. This is again very important because if you have fewer number of mentors, your training also, there will be a problem in that you are exposed to fewer number of consultants. So every consultant will have their own diagnostic approach, and even in treatment modalities, you will see slight differences between your consultants. So more exposure will definitely enhance your learning. And the next point is also very important: increased faculty availability. So, what do I mean by increased faculty availability? See, when you are having your residency, suppose you are on a night call, okay, and suppose you come across a challenging clinical case scenario, either in the ward or in the emergency. Only if you have a consultant in loop, at least in the initial phases of your training, you will always gain something out of that experience that you actually face. Okay, so that availability should be there. Sometimes what can happen is that, suppose you are taking a emergency duty and you're a first year resident, and the only contact point is maybe a final year postgraduate. Now, he may be good, but again, experience always makes man wise, right? So, if you have got a consultant also in loop, okay, that availability is there, then whether it be as a ward, medical officer or a casualty medical officer, if you have got a consultant in loop, that again will enrich your learning as well. Okay. And next point is also quite interesting. Diverse faculty brings varied experience and expertise. What do I mean by that? Look, see, during your residency training, you will come across multiple faculties, and you will come across faculties who are probably, maybe one of them is an expert in diabetes management, one of them is an expert in critical care, one of them is having a good structured approach dealing with uh, you know uh, case diagnosis. So you will have to learn from everyone. And when you have more number of mentors, medicine is such a, such a beautiful branch. You will have people with different approaches. So you will have to see, you will have to learn from them, and you will have to develop your own approach as well. So when you get exposed to multiple such faculties, this is definitely going to help you without any doubt. Okay, right. Now, next point number 6 is a streamlined academic program. So this again is important. Now, most of it will actually depend on the head of the department as well. Okay, which means every department will have an academic program, right? And this has to be properly streamlined. And you know how you can know whether a particular department has a streamlined academic program is like, you can talk to someone from that department and try to understand what happens in a week. Okay, what happens in a week of that resident's professional life. He'll tell you, Monday this presentation is there, Tuesday we have got journal club, Thursday we have got case presentation. So you try to understand that. So when you will have these sort of topic presentations that you're likely to have, this will develop your presentation skills, your communication skills, your confidence, your ability to speak in front of a crowd. That will definitely help you for that. Next, in addition to these topic presentations, many departments will also have clinical case discussions, which are also very important. Because see, medicine is not just about learning theory alone. You will have to have clinical case discussions as well. Yes, a part of these discussions will happen during your routine rounds. Yes, definitely yes. But in addition to that, most departments, will have dedicated days where they are discussing a particular clinical case. So that will be a full-length discussion of that particular case, wherein a resident will actually present that case. A consultant will actually, correct his mistakes on his approach to the diagnosis or the way he has taken the history. He will, check the way the resident has demonstrated the clinical signs. So all this will be, taken into consideration. So such sort of clinical case discussions are definitely going to be very helpful. Then journal clubs, again, very important. Again, many departments will have these journal clubs, and journal clubs always keeps residents in touch with the latest research. Now, this is also important. You will be busy during your residency. You will have so many patients to cater, but you will also have to learn. So it has to go side by side. And it's also important to keep yourself updated with what is happening. And for that, these journal clubs would definitely help. Yeah, that is going to be another point that you will have to consider. Next is regarding the super specialty departments. Now, certain medicine departments will actually give you a mandatory posting in all super specialty departments, mostly in second year. But again, there are certain colleges where you do not have that opportunity as well, especially in colleges where you do not have well functioning super specialty departments. But if you are taking your residency seat in a college with good postings in super specialty departments, that is always going to be helpful. Exposure to different super specialties will enhance your clinical understanding. So that sort of exposure is very important. Okay, and see, uh, even in medicine department, you may have a stroke case being managed. Even in the neurology department, also you will have a stroke case being managed. But there is a good chance that in the neurology department, it is more protocol driven. I'm not saying that in medicine department it is not, but it is the probability that it is more protocol driven and more in tune with what the current guidelines are. So it is always an opportunity for medicine residents to get exposed to all this. Okay. And you also can have opportunity for hands-on experience when in multiple disciplines. For example, if you are posted in nephrology, you might actually have an opportunity for say doing a renal biopsy. Okay. Or if you're posted in the gastro department, maybe they at least actually help you in doing a scopy. So this can happen. So this sort of opportunity is also very important. And very importantly, this can help in decision making as well on pursuing super specialty, because I've seen that a good number of residents come to a choice for their super specialty mostly after their second year SS postings. Okay, that is in medicine. As I said, it's mostly in second year that you will have these rotatory postings in the super specialty departments. Uh, I know that some of you might already enter a medicine residency thinking that you want to be a neurologist or a cardiologist or a gastroenterologist, but for many of them, exposure to these super specialty departments can sometimes even change their initial thought process about a particular branch, and then they might go on to take some other SS branch as well. Okay, right. Next is established laboratory and diagnostic facilities is my checklist point number 8. Now, see, these are actually supportive resources. Okay, supportive resources for comprehensive case workups. Now, imagine you're working in a hospital, and that particular college does not have an MRI machine. Now, that is significantly cutting down on your approach and diagnosis of certain neurological disorders. And many a times, because that facility is not there, you either want to get it done from some outside setup, or maybe you can refer the patient. But if you have all facilities available, it is definitely going to augment your case workup. And when you have got quality diagnostic tools, obviously it is going to improve and enhance the patient care as well. Ultimately, the patient has to be benefited, right? So when you have got such a good setup, it will definitely help as well. And these sort of laboratories will actually aid in protocol based management as well. That is also important, because when you are short of resources, again, the proper case workup you may not be able to do. So this will again interfere with the actual protocol based management as well. Checklist point number 9 is the departmental environment. This is also important. Now, look, you're working in an environment, right, for 3 years. And for those 3 years, the maximum time of your life in those 3 years, you're going to spend in that department. So you need to address your mental health as well. This is something that I always talk about, because only if you have got a supportive atmosphere, this will promote your mental well being, and this will definitely enhance your growth as well. Okay. So you have to make sure that the departmental environment is good. Positive interactions with peers definitely foster collaboration and teamwork. And as I told you, teamwork is very important, and it is the essential backbone of a good residency life as well. And it's also important to have access to resources. See, when you are in a department, and as a resident, if you don't have access to resources, maybe your laboratory setup or whatever it is, then you are short in your training, right? So when you have multiple opportunities to access the resources of the department, then it will definitely enhance your academic development as well. Okay. Then checklist point number 10, which is probably, I think, one of the most important points. I was talking about average number of OP cases, IP cases, how the overall department functioning is. But to know about all this, because see, when you go for a choice filling, especially if you're a mid ranker, you will have to fill in a lot of choices. So you will also have difficulties, sir. Which college to put here? What should be order number? What should be position 2, 3? Well, to understand more about the department or the college that you are choosing, it's always important to talk with a senior postgraduate. So why do I say that? Because when you talk with a senior postgraduate, you will get their honest opinions and insights about that particular department. You might have heard a college X is very good. So you might choose that college, you might put it in your preference, but you might not have inquired about a particular medicine department in that X college. Now that is also important. Sometimes what can happen is that you hear the college is good, you assume that all departments are good, which may not be the case always. Okay. And when I say senior postgraduate, I always would prefer you to ask opinions from second year or a third year postgraduate, or maybe from a senior resident, rather than a first year postgraduate of that particular department. I'll tell you why. Because a first year postgraduate, has not been exposed fully to the department. That is a fact. Now he's probably one person, who's having to work a lot in the department. So if you call a first year postgraduate and ask him how is the department functioning, there is always going to be some sort of a bias towards negativity. The reason being that the first year postgraduate has a lot of works to do. He may not have time for academics. It's usually in the second year that your academics become better. You get relatively more free time, and and once you are in the final year, you get better command of the subject as well. So I would always prefer you to get opinions from second or third year postgraduate. Okay. And if you have someone who's already known to you, you can connect with them. But if you do not have a direct contact, at least try to talk to your friends. Your friends might have some sort of a contact, and try to make use of every opportunity that you get. This is also important, because sometimes what can happen is that you may not talk with a postgraduate to understand how is the department's work culture, overall work culture. Then you may not actually encounter what are the challenges, because somebody who's a final year postgraduate will actually tell you, look, these are the positives of these department and a few negatives are there. Okay, so I think it's very important to talk to a senior postgraduate. So these are the 10-point checklist that I want all of you to go through. But let me tell you one thing. As in life, there is never a perfect choice. You can go through this 10-point checklist. This is just a guide to make decisions. You will definitely come across colleges wherein some of these points you will have a tick, but some of these points you will have a question mark. In life, there is no perfect choice, but take into consideration your interest, and then you decide your college. These points I'm telling you as a senior, which will actually help you in narrowing down your choices, or maybe adjusting your choices. That's it. Okay. And never go to residency expecting a red carpet. Okay. Sometimes what can happen is that over expectations may be there. You might think that, okay, once you enter medicine residency, you may have faculties teaching you right from the basics, maybe so much of clinical demonstration being there, your diagnostic approach improves. But suddenly you see that first year is most about being in the wards, lot of ward work. If you don't have a realistic expectation, sometimes that can backfire. And initial few months, you will have adjustment problems as well. So that is what I want to tell you. It's very important to understand how that particular department functions. You try to understand from your seniors. So if you get that sort of an understanding, it's easier to gel into the department. So sometimes, a resident walks into the department having absolutely no idea on how that department functions. So he's also not sure on how he can contribute positively to that particular system. So it is important to be aware of all this before you actually, make a choice as well. Okay. Now, you can connect with me in case you are listening to this session later. We have got pan India medicine resident groups where we actually engage with students and have active discussions about case scenarios. So if you are a medicine resident, please feel free to join this group. We have already had two groups now for exclusively for medicine residents. This is apart from the WhatsApp groups that we have got for the super specialty aspirants, but this is purely for medicine residents across India, MD and DNB. You've also got faculties in this group of DocTutorials, because DocTutorials has the residency as well as super specialty entrance training. So if you want to join this group, if you are a medicine resident or if you are going to join medicine residency, you can just send me a message in my inbox. This is the QR code of my Instagram page. So send me a message in Instagram that maybe you're planning to join this particular college, or maybe you've already joined. I'll send you the link to get added in this group of Pan India Medicine residents. So please join this particular group. And yeah, that's it. I wish you all the best for your residency. And I hope that God bless each one of you. It is going to be a roller coaster ride, and you will have good days, you will have bad days, but sometimes even very bad days as well. But I am sure that, with your effort, commitment, and a good support system, you can definitely excel in your residency. And please understand that you're walking into residency as a student, and you will walk out also as a student. So no one can be very confident in medicine. Everyone will make mistakes. You will make mistakes. I will make mistakes. We are all learning, and it will be a continuous learning. So don't feel ashamed or embarrassed when you make mistakes. But every mistake that you make is an opportunity to evolve into a better doctor, a better physician. That is what I would suggest to each one of you. Thank you so much, everyone, for joining this session, and I wish you good luck for your future as well. Thank you so much.